website that she referenced. We'll also send that out post event as well, so you all have that. So I think now what we'll do, because we got a lot of really great questions in the chat, is we will just go right into some Q&A. So Dr. Arwady had to drop off, but we do have faculty from the UIC School of Public Health. I'll invite Dr. Dworkin to introduce himself in just a moment. And then we also have Patrick Stonehouse from CDPH. They're gonna help answer questions that came up in the chat. And of course, if there's any questions that we can't get to, we will definitely follow up post-event and make sure that you have all of those answered. So let's start with Dr. Dworkin. Do you want to take a moment and introduce yourself to the group? And I'll start to collect some of these questions for you.
Okay, great. Yeah, so hi, I am Dr. Mark Dworkin. I'm from UIC School of Public Health, and I am an epidemiologist and an infectious disease physician. In the past, I've worked for the State Health Department, Illinois Department of Public Health as the state epidemiologist. And before that, I worked and trained with the Centers for Disease Control. I do a variety of research and teaching. My research includes areas of HIV and has included food safety, food poisoning prevention over the years.
Thank you. And before I start shooting off questions to you, did you want to respond to anything that you heard Dr. Arwady say, or any just quick reflections or anything you'd want to expand on that you heard in the keynote?
I don't want to expand on anything. I thought she did a marvelous job. I haven't heard her in this setting recently, and I just thought she really covered a lot of information in a short period of time. Very thoroughly, and we're very fortunate to have her in her role.
Well, I'm just going to start. There's, again, a bunch of questions in the chat, and I might have team members help me in just case I miss anything. But I think one of the first questions was about, let's see, how to determine, which one of these vaccines or the differences between them, or where people can find information about, what's the best one, for lack of better words. So if you have any thoughts on that?
Yeah, so one of the questions that you're basically asking is, how are these vaccines different, so that you can make a decision perhaps of one versus the other, the Pfizer vaccine and the Mrna vaccine, since they're both the currently available vaccines. For all practical purposes, they're very similar. And if you're offered one, I don't have any great reason to choose that one over the other. The things that you should be aware of that are some differences, if you're going to consider them, are that the Pfizer vaccine has been approved for age 16 and older, okay? The Mrna vaccine has been approved for age 18 and older, and is currently having trials of 12 through 17-year-olds. So that is the difference between these two vaccines in terms of their current licensing. That may change, or I should say emergency use authorization. That may change over time. As far as the efficacy goes, it's basically the same. 95% efficacy was shown for each of these vaccines in their separate trials. And 95% efficacy after 2 doses is outstanding. We only wish we had that kind of efficacy for flu vaccine that we use every year. So in terms of efficacy, they're both great. The difference in terms of administration is that one of the vaccines, the Pfizer vaccine, you get it on day 0, and then 3 weeks later, you come back for the second dose. The timing of the Mrna vaccine is a little later. You come back 4 weeks later instead of 3 weeks later for the Mrna vaccine. So if that at all affected your choice, you can keep that in mind. The amount of vaccine that's in the injection is less in the Pfizer vaccine. They say it's 30 micrograms versus 100 micrograms in the Mrna. But despite the Mrna having more vaccine in it when it gets injected, it actually has the same, not better, efficacy getting shown. So it doesn't seem to matter how much you're getting in the shot. They're basically similar. The side effects. Yeah.
Can I just interrupt for just 1 second? Can you explain what efficacy means in this context?
Yeah, so when we're talking about efficacy, like 95% efficacy, we're talking about how well the vaccine works at doing what it was set out to do, which is to prevent you getting symptomatic COVID infection, symptomatic, where you're sick. Now, that means that we still are waiting on more information about to what extent, it might be preventing asymptomatic infection, okay? But symptomatic infection is what we care about the most, right? Because that's what's going to make you feel badly, and that's what's going to possibly put you in the hospital. So symptomatic infection is prevented. 95% of the people who got the vaccine, you can think of it that way. It's the easiest way to think of it, is that 95% of the people who got the vaccine had protection. So almost 100%, 95%. So that's terrific. That's what we mean by vaccine efficacy. There's another term that's used sometimes, vaccine effectiveness. Okay, vaccine effectiveness is kind of similar, but efficacy is what we talk about from that clinical trial where they're doing that test. Effectiveness is what we're going to learn now as it rolls out through, hundreds of thousands of people, millions of people nationally. They'll be studying it some more, learning more about it, and we'll see how effective it is under ordinary real world conditions, as opposed to whatever conditions the clinical trial imposed to do the study. So there's more to be learned over time, but what we know so far is high efficacy.
Great, thank you. Let's see, another question. Let's see, there's so many, so bear with me just a moment, folks.
I
There's a lot
can
of
finish
questions.
answering that last question though, because there's a couple other differences between the vaccine.
Okay, yeah, go ahead.
So the side effects between the two vaccines are essentially the same. Some pain in the arm, and then you may have some sort of feeling of, some people will have a feeling of illness, especially after the second dose, but sometimes after the first dose. And that might include a headache, some muscle aches, some joint aches, and in some few people, maybe even some fever. Now you may say, well, did I get COVID? It's like, no, that's not COVID. That's your immune system working. That's the vaccine working and training your body on what needs to go on internally in terms of fighting the infection in the future. Those are the symptoms of that happening, of the machinery of the body working. And so if people develop, these kind of relatively mild symptoms, they shouldn't be alarmed. They should actually feel empowered. It's like, yeah, and this is not going to last long either. Usually it's just 1 or 2 days that people have these kinds of complaints. So that's one thing, and they're both similar in that way. The other difference between the vaccines that you may have heard about is how cold the vaccine has to be kept when they're storing it and shipping it. Okay, in the case of the Pfizer vaccine, it goes all the way down to 94 degrees Fahrenheit. They have to have it that negative 94 degrees Fahrenheit. It's got to be negative 94. Special freezers are used. The Mrna vaccine has to be kept frozen as well, but not that cold. Negative 4 degrees Fahrenheit is for that one. That's going to make the Mrna a little bit easier to deal with over the future in places like, for example, a CVS or wherever else they might put it in the community, because they won't need those special freezers that they might put into, let's say, hospital settings.
So a question that has come up quite a few times, see if you can speak on this. Folks are asking if the shot contains any type of tracking device or microchips. And this has come up a lot.
Yeah, there's absolutely nothing like that in this shot. The ingredients of these two vaccines are very similar. For example, they both contain messenger RNA, which then eventually gets destroyed by the body after it gets used for its purpose. And there's other ingredients, mostly the same, but a little bit different, certain kind of a salt in one of them versus the other one. They both contain cholesterol and fats that help stabilize this for its purpose. But no, there's nothing like that in the vaccine.
Let's see. Can you talk, I think Dr. already covered this a little bit, but can you talk about, why was this vaccine developed so quickly in comparison to others?
Yeah, well, I mean, I think that is one of the benefits of where we're at in terms of the history of the world, right? It's 21st century, we get to have benefit from 21st century technology. So for the last 10 years or so, there has been developments made in this messenger RNA kind of vaccine development. They've had experience with messenger RNA vaccines with a few other diseases like Ebola and I think maybe yellow fever. So we already have had a track record of building vaccine along these lines. Then you think about what else is going on that's different. Well, how about mobilization of the world scientists, with politicians and money behind it, in large numbers with great urgency. So when you put all those things together, right, you can really do some amazing things in the history of the world. You think back to putting a man on the moon, right? They did that within a decade after declaring that there's something that they wanted to do and safely brought them home again. All right. So when a lot of money is put into science, at like a huge level like this, then you can do things relatively quickly compared to in the past. So that's what's going on here.
And do we know how effective this vaccine is against the new strand of COVID that came out of the UK?
No, we don't have that information. I've heard that that is something that's under study. And obviously that's a very important piece of information we're going to want to understand. I'm hopeful that it's not going to be a big issue, and if it is, remember too, we have had other vaccines like flu vaccine that contain more than one strain, that are effective against more than one strain. And so if we find that this is an issue, they're going to be able to develop the vaccine so that it could be good for more than one strain down the line.
Thank you. So I'm going to see if I can give you a break for just a second, Dr. Dworkin and Patrick from CDPH, if you're on the line. We have some questions about distribution of the vaccine. I want to see if you know or if you can share any details about how the vaccine will be distributed, specifically if there'll be any vaccine distribution sites or if folks will be able to get the vaccine in clinics or other settings.
Sure. Yeah, there are vaccination, we call them at the city, we call them points of distribution. And we're in the process of standing up a whole bunch of those very, very, very quickly. We'll talk about this a little bit more later on when I speak about the implications of the vaccination or the vaccine for the contact tracing core, but you all have already been surveyed by the Chicago Cook Workforce Partnership to see to gauge your interest in staffing some of those vaccination points of distribution that are going to be starting, next week, right? So like we're standing those things up real quick. By the end of next week, I think we're planning on having 4 vaccination points of distribution up and operating Tuesdays through Saturdays, 11 a.m. to 7 p.m., providing vaccination to folks. As Dr. Arwady stated, we're prioritizing certain populations and certain folks who work in certain areas, but we're standing those up right now. In terms of vaccination availability in clinical settings, it's already available in some, as I understand. So yeah, we're moving on all of that.
Okay, thank you, Patrick. And another question, I'm sorry, for incarcerated individuals, do we know when they'll have access to the vaccine?
I do not know that. I've heard debates related to it, like when would we prioritize individuals who are incarcerated against other populations. And I don't know where those individuals currently lie in terms of the priorities. We can try to find out.
Okay, great.
I can say that the CDC has the guidance, and I see that they're on the 3rd tier, with the 1st tier being the healthcare workers and first responders, and immediately after that are people with comorbid conditions that put them at risk of high high risk for severe disease or death, and older people in congregate settings, like she mentioned earlier. And then right below that is a group that includes people who are in prison or jail and or work in those settings.
Great, thank you. Let's see. So can you talk a bit about the vaccine and folks with allergies? There's a lot of questions about, is it safe for folks if they have allergies, or, should they receive it, or just, can you talk a little bit about that?
Me?
Yes, sorry, Dr. Dworkin.
All right, looking behind me here. Okay, so as far as the allergies go, they're basically saying if you've had any allergic reaction to any of the components, any of the ingredients of the vaccine, and those are, provided to you that when you go get a vaccine, they have a sheet that they give you with information. And so if you've had any allergic reaction in the past to one of these components, or if you've had an allergic reaction in the past to the COVID vaccine, for example, maybe you were in the trial, perhaps, those are the only things that have been listed so far.
Great. And we're getting a lot of questions. Folks want to know, where can they find a list of the ingredients in the vaccines? What are some credible sources that you would recommend for that information?
Well, I can tell you that before this this session, I Googled that. I just typed in ingredients and COVID vaccine and Pfizer and Mrna, and I was able to get a list. I can't remember the website though, but when I looked at those ingredients, they looked like what I'd seen previously elsewhere. So I don't think there'll be much of a problem with it.
Yeah, and we can find a list to share with folks post-event. Let's see. And so, Dr. Dworkin, how long does protection last?
Well, that's a good question. Everybody wants to know that, in terms of even the scientists who are studying the vaccine. We know that they studied it for 3 months, and they were able to show that so far there was at least 3 months of efficacy. But as we have more and more time following the people who got the vaccine, we'll have more and more data. So we can't say with any certainty how long it lasts. We can just say that we're hopeful that it is a long-lasting vaccine, and wait for more data.
Thank you. And Patrick, I'm going to bring it back to you. Do you know if there will be a cost for the vaccine for Chicago residents? Patrick, are you on mute?
Thank you. I was not allowed to unmute momentarily. So when the points of distribution the CDPH is standing up are going to start, those vaccination sites will be at no cost to the individual. Otherwise, it's probably going to depend on the specific situation that you're operating within. If you're going to a medical facility, there may be like a copay or something along those lines. But the ones that we're standing up are going to be at no cost.
And another question for you, Patrick. So there's a lot of distrust on the vaccine in the Hispanic community. What is CDPH doing to reach out to that community in particular?
So a fair amount of stuff, everything from having conversations like this one right now, where we try to have some really just straightforward, open interactions with people, with each other about what our concerns are, and try to provide accurate information back out to folks, as well as, and I think this it cannot be overvalued, like hearing back more and more what folks' specific concerns are so that we can try to address them. We're also doing some more focused efforts in developing what we're probably going to be referred to as sort of like vaccination ambassadors within certain populations for whom there's a long-standing and warranted mistrust of medical systems and vaccination. there are reasons that people have fears and concerns about this vaccination, and I don't want to dismiss those very valid reasons. So engaging with folks to develop, you know, we're really good, I think, at the health department of putting forth the public health information and guidance. And one of the things that we recognize that we're not always very good at is putting it in just like everyday person terms. And so one of the things that we are doing a lot of work on is working with folks from all over the city, from whether it's Latinx populations, whether it's Black or African American populations, older, younger, to figure out how do we facilitate folks putting this stuff into their own everyday language and owning it and feeling comfortable and safe and valid in sharing that information with their peers, their families, their lovers, their families, all that stuff. So we've got work going on with a couple of different citywide institutions that are representing and made up of Latinx populations. We're working with a couple of other different regional efforts on the Southwest side and to get all that information out and also back in. Because again, it's really important for us to get information out to folks in a way that is that folks can use, but it's also really important for us to get information back from folks about what is and what is not working.
And one more question for you, Patrick. What is the SHY app for vaccine registration?
So so there's a couple of different things that could be referring to. Like there's the SHY COVID coach that is involved in, you can get information about vaccination opportunities that are present to you. It also like does some monitoring of symptoms work. And then I think there's a, let's see if I can find it. Thanks, Goody, for putting the SHY COVID coach up there. I thought there was another one that was specifically for registration, but I can't find it right now. But I'll see what I can do to find it. But I mean, for the most part, for registration for vaccination at this point, there is a site that the organizations that are deemed prioritized and essential have the opportunity to register their staff, all the folks involved to get vaccinated. And that's one of the opportunities that's been presented to the contact tracing corps as well, to make those calls, to work with those institutions to get folks registered for vaccination.
Great. And one more for you, Patrick. Well, this might not be the last one, but so people are starting to get text messages and phone calls to pay certain amounts to get the vaccine earlier. How true is this?
Nope, absolutely not. I would not do that. What I would request, if you get one of those, feel free. I think y'all have my contact information. Like send me the number that it came from, because that's the kind of thing that I think we would, at the health department, would want to know about, so that we can make sure that we're sharing accurate information. But I've heard nothing about the ability to pay your way into prioritization for getting a vaccine.
Thank you. I'm going to send some questions back over to Dr. Dworkin. So Dr. Dworkin, can people who currently have COVID take the vaccine?
No, if you currently have COVID, they're recommending that you wait 3 months and then get the vaccine.
And is this vaccine a cure or prevention? And can you talk about the difference between those two?
Yeah, this is prevention. The idea is to prevent you from getting symptomatic COVID. And a cure would be what we would talk about if you had COVID and we were trying to get rid of the infection quickly without complications in you.
And so to clarify, are there any cures for COVID right now, or just treatments?
There's just treatments right now. They're of, different efficacy. Some of them seem more potent than others. We don't have anything that I've heard is really, a tremendous magic bullet, but we're getting closer with some of the latest treatments.
Great. And is RNA the same as DNA, and does it change your genetics?
Okay, so mRNA is not the same as DNA. It's similar. You might think of it as a mirror image of DNA. DNA has two strands, if that's of interest. mRNA is a single strand. But no, it does not change your genetics. The mRNA is being used in order to deliver information to your immune system so that it can create antibodies to something called a spike protein. Spike protein is what we are targeting that is part of the COVID virus. And the messenger RNA is specifically designed to teach your immune system about the spike protein so that it is ready for it if it gets in the body.
Great. And can you still be a carrier of COVID and spread the virus if you're vaccinated?
Can you be a carrier and spread the virus if you're vaccinated? This is something that we're still waiting for definitive information on. Because we don't have that definitive information, people are being told, once you get your vaccine, please continue to wear a mask. Over time, we may find out that people who have vaccine don't need to wear a mask. But until we have that kind of data, this is something people are still being told.
Thank you. First of all, thank you everyone for posting all these excellent questions. This is so great. Let's see, I think I'm gonna send a question back over to Patrick. Will the vaccines be mandatory?
Yeah, like even if you're like working at a vaccination pod, which is like, again, that's one of the opportunities for folks. It's been made clear that it's not going to be a requirement that you get vaccinated before doing the work. So, I mean, at this point, it is not in the pipeline that it's going to be mandated across the board. There's going to be some, there are implications, obviously, not taking all of the protective precautions involved in trying to address the pandemic, but it's not like, as far as I'm aware, no one's going to like lose their role as a contact tracer or a supervisor or resource coordinator if you don't get vaccinated. Like, I'm not going to lose my job as director of public health operations if I don't get vaccinated, I don't think.
And just to expand on that, so do we know if it'll be mandatory to get vaccinated to leave the country or enter the country even?
I don't think we're at that point of having that like set up. So no, I don't think so.
Thank you. I'm gonna pass it back to Dr. Dworkin. Is it recommended that pregnant or lactating women get the vaccine?
Well, basically, you could say that the answer is yes. Everybody who could potentially get the vaccine should get it, and there are no current contraindications. They do say, though, talk to your healthcare provider.
Great. And there's a lot of questions about specific health conditions and if folks would be recommended to get the vaccine. Where would we recommend that folks find that information? Because there's, folks want to know specifically blood clots, asthma, heart disease, et cetera, et cetera. What's a trusted source to, find information about each individual's unique kind of situation?
Well, I think we're going to need to look into that for that much detail. The first place we'll probably be looking is the CDC website, but I haven't committed to memory where you'd find that.
And that's something we can do some research on and share some resources post-event.
I want to throw out on that point, though, and I think these are tremendously important questions, and I want, obviously, to keep them coming. For individual level, we can do some work and find some research and obviously make recommendation. Talk to a medical provider if you have particular health concerns. For the purpose of and so that's like for you and for me as like folks who live here and interact with folks and have concerns. As contact tracers, I do just want to caution, remember, we're not going to be in a position where we as the contact tracing corps are providing medical advice to folks. So if these are questions like for me or for my mom or for my auntie or anything like that, totally legit. But if it's, when a contact asks us this question, like, we're not providing medical advice.
Thank you, Patrick. Patrick, can you share, will people who are undocumented have access to the vaccine?
Yes.
Dr. Dworkin, let's see, bear with me. So many wonderful questions. So Dr. Dworkin, I'll send this one to you. There's been talk of the folks getting just one shot of the vaccine instead of two, so that more people can get vaccinated. Do we know if that's just as effective or how effective that is at preventing COVID?
Well, I know that with the Pfizer vaccine, one dose is almost as effective. I believe what I saw was around 90%, which is very good too. That's why it's been considered. But I think in the end, it probably won't be that they'll be doing a lot of one-dose vaccine until we have an actual one-dose vaccine, like Johnson & Johnson, I heard, is creating a one-dose vaccine. But short of that, what's been studied, what we know the most about, is the two-dose. And so I think they're probably going to stay with the two-dose for these particular vaccines that were studied in that way, rather than experiment with them as one doses.
And there's also been talk about splitting the doses. So maybe one shot would be one vaccine and the other one would be one would be Mrna, one would be Pfizer. Do we know, or is there any research about how effective that is, mixing the vaccines?
I haven't seen anything on that. So I don't even know if it's being studied at all.
Okay. I am just going to check through the chat because there's been a lot of questions. Make sure I didn't miss anything. If there's anyone on my team that sees a question I missed, just feel free to jump in.
Well, I saw a question or a comment earlier when we were talking about something else where someone was clarifying if I had said 3 months in terms of how long the immunity lasts from the vaccine. And I just want to be clear that what I'm saying is that they studied it and showed 3 months so far. So we would want to be careful if we were talking to anybody that we didn't say it only lasts for 3 months. Okay, what we know is that it lasts for at least 3 months, and we're waiting for more information to see how much longer than 3 months it lasts for.
Thank you for clarifying. So did the search for the HIV vaccine help with the development of this vaccine?
I think that's very likely. That's very likely because for years we've had a large number of scientists who've been working to try to develop an effective HIV vaccine, and they've learned from both their successes and their failures over the years. A number of those scientists are, involved in one way or another in informing the research for this. And so I haven't seen the dots connected directly, but I think the answer is yes. And this success, we hope, will inform future HIV vaccine research.
Another question, what about immune compromised from medication? Someone that takes Humira or Enbrel, has it been tested for complications with other medications?
I haven't seen any data that specific.
And let's see. What was the size of the clinical trials for the COVID vaccine?
Around 30,000 were in these trials. So often they'd have maybe around 15,000 per arm of the trial. In other words, 15,000 who got a vaccine, 15,000 who got just a shot, but not a vaccine.
And I just want to say, if there's any folks that have questions that you don't want to put in the chat, feel free to send them to me directly. Another question, so why should people of color trust the vaccine considering the history of medical injustice against them?
Well, that's a really great question. I can only say that I got the vaccine, okay? I want my mother to get the vaccine. I want my family to get the vaccine. And I want anybody to protect themselves, just like I'm trying to do what we can in this circumstance. I understand some of the history that they're referring to, and it certainly makes me pause. But the bottom line is, we all need to fight back on this. We all need to fight back on this together. And it would be a shame if racism and crimes that have been committed over the years would interfere with actually protecting all populations that need this vaccine, which is all of us.
I just want to add to that real quick, if you don't mind. So this is, it's such an important question that needs to be asked all the time, right? And recognizing that I, as a white dude, probably not going to be able to provide the most best answer. This is one of the reasons why, as has been mentioned, there is a big town hall happening tomorrow evening. I'm going to put it in the chat, and it's specifically what Black America needs to know about COVID-19 and vaccines, right? And there's a bunch of like really impressive folks on that panel who are going to be doing it. So I'm going to put the link in. So the description is, leading Black health, faith, and social organizations invite you to attend a virtual town hall. So like, I'm going to put it in the chat so you all see, like, this is the link to go do it. Like, yeah, that's going to be where you're going to get some really great information.
Thanks, Patrick. And we'll also send it out via email post-event. Okay, so let's see. So how many people need to be vaccinated to eradicate COVID entirely? And Patrick or Dr. Dworkin, if you want to answer that.
Well, the numbers that I hear change over time. And I think it's also going to depend on how many strains are circulating. It's going to depend on how well the current vaccines cover the different strains that are circulating. So there is no precise answer that is available at this time. I've heard numbers like 70%, 80%, 90% of the population. I've heard all those at different times, and I don't have enough data. I don't even know if anybody has enough data to precisely say what that number's got to be.
And why is the COVID vaccine more effective and different than the flu shot? Because folks are hearing things like, every time I get the flu shot, I get sick, so I'm not getting the COVID vaccine.
Okay, well, if you get the COVID vaccine, you might feel a little ill. That's part of the deal. You know, that it doesn't mean you got COVID, but it's so much better than getting COVID, you know, symptomatic COVID. But I understand the hesitation. But the question was what? Why?
Oh my gosh, should I lose it? Hold on.
Oh, why is it more effective?
Why is it more effective than the flu shot? Yes.
It's a different manufacturing process. They take an educated guess with the flu shot every year. The strains that they put in it, they make an educated guess of what they think is going to be the predominant circulating strains, because there's a bunch of strains of flu out there. With this, I think they got really lucky. You know, they targeted a particular protein that they thought might be relevant, and all of a sudden it turned out to be almost a bullseye. So I'm glad for that, but the bottom line with the flu vaccine is it's an educated guess every year, and sometimes it's wrong.
Patrick, I think this one's for you. What's the plan to ensure equal distribution of the vaccine in different communities?
Yeah, I'm muted. Yeah, I'm gonna have to get back to you on that one. I've not been intimately involved in the distribution planning as a citywide effort, so much as staffing for the specific points of distribution that we're working on. But I do know, like on the website, the vaccine site, there's a fair amount of information that's specific to vaccine planning. But yeah, we can get back to you on that.
Thank you. So as I continue to scan through the chat, Dr. Dworkin, is there anything I didn't ask you that you wanted to address regarding the vaccine? Any question that didn't come up that you think that is worth discussing?
Yeah, I don't have anything to add other than to say that just like a lot of people, when I first heard about the vaccine and the vaccine trials, and I'm watching the news, I was a little bit concerned about the vaccine, you know, but the bottom line is the risk benefit and the safety and the efficacy. And that just made it logical to go ahead and get vaccinated. I did. I felt some soreness. I felt a little achy for 48 hours, and then I was fine. And that's the story that I've heard for most people who had the vaccine. So while I certainly understand caution, I think that, you know, the big picture is this is a historic global pandemic with a deadly disease, and here's something we can do to prevent. So, you know, I encourage people to move forward with it.
So so in the vaccine, are people getting infected with a different virus that repels COVID, that isn't deadly, but it has the same kind of DNA structure? Does that make sense?
Can you repeat the first part of that?
Yeah, so are people getting injected with like a different virus that basically fights off COVID?
Oh,
like,
I see.
Yeah.
I see. No, there are vaccines that are kind of like that. You know, there are different kinds of vaccines that we have for other diseases where sometimes you get a live virus that's been modified in some way so that you would have training against that particular disease. But no, that's not the case here. There is no COVID virus in this vaccine at all. It's just this messenger RNA that basically helps to train your immune system about that spike protein.
Question for Patrick. Who will know if I get vaccinated? Will my information be safe?
Yeah, absolutely. So the information of individuals who receive vaccination, like that's highly protected public health information that we wouldn't be sharing. It would be strictly confidential. So the folks who would know would be the you and the individuals involved in providing you with that vaccine. We would have records of it, but similar to other public or protected and secured data, no one gets access to that information without like real strict guidelines.
And for folks that joined late, Patrick, would you mind just introducing yourself again, your title and your role at CDPH? A couple folks asked in the chat.
Sure. So my name is Patrick Stonehouse. I use he, him, his masculine pronouns. I work for the Chicago Department of Public Health under non-COVID circumstances. I'm Director of Public Health Operations for the HIV/STI Bureau operating in community health services, looking at structural and systemic barriers. So like, what are the things that need to change in the entire system in order for folks to be able to achieve some of the health outcomes we want. Within COVID response, I'm working with a bunch of folks, including the Chicago Cook Workforce Partnership and USC and NORC, Sinai Urban Health Institute, and Malcolm X, as well as others to build up and support the Community Contact Tracing Core, the Resource Coordination Hub, and some other efforts that we've got going on. Yeah, that's me.
Thanks. And Patrick, will the lack of pharmacies in lower income neighborhoods in Chicago interfere with vaccine distribution?
Yeah, it can, which is one of the reasons why when we're standing up our points of distribution, we're specifically looking at having those operate within some of those areas where we're seeing that there aren't sufficient already pre-existing facilities that can provide it.
Thank you. And Dr. Dworkin, I'm going to go back to you. Can you also please just reintroduce yourself for folks that joined late and tell them about your role at UIC?
Yeah, I'm at the UIC School of Public Health. I'm in the Department of Epidemiology and Biostatistics. I'm an epidemiologist and an infectious disease physician. And I teach and do research.
And what's epidemiology?
That is the study of the distribution and determinants of disease. Distribution, such as what parts of Chicago is HIV, more prevalent in? Where should we target our interventions based on those geographic locations? That's distribution, and determinants are things like risk factors. What's put you at higher risk for COVID? Such as, turns out, diabetes is higher risk for getting more severe COVID, or obesity. It's the study to determine those kinds of things. That's all part of epidemiology.
Thank you. And can you elaborate a bit more about what a spike protein is?
Yeah, basically the spike protein, you could think of it as a component of the virus that helps it to attach to your body, like in your lungs. And there's a lot of these spike proteins on this virus, which makes it easy for it to attach. And so this is why it's a key area for targeting your immune systems.
Right. And do we know if the vaccine is effective for animals?
I have not heard anything about that.
And Patrick, there's a question about the vaccination pods. If you're going to talk about this later, we can hold off. But folks want to know, for those who might want to work in the vaccination pods, does that change the length of employment for contact tracing?
Yeah, I saw that one, and it's something we've been thinking about. At this point, the answer is no. It does not change the length of employment. So two ways of that. One, these are completely separate sort of funding efforts that are coming into play, and the positions are largely tied to these funding efforts, right? So because they're separate, there isn't really an impact of having these points of distribution stand up on the length of time that a person could be employed as a contact tracing corps. That said, like working in the pods, like that is another like professional development, career exposure, and this is something that I was going to talk about later on. But like the opportunity for further employment through doing work at a pods, like yeah, that's a real thing to consider. But at this point, we're not seeing the introduction of the pods and people working on the pods as being an extension in terms of like total amount of time that you're employed.
Let's see. So Dr. Dworkin, to your knowledge, how many strands or variations are there of COVID-19?
I couldn't give an accurate. I can think of 3 at the moment, but I haven't counted them up. And there'll be more. That's normal for viruses over time.
Okay, just bear with me, folks, as I go through the chat. I think we might have addressed this one, but just again, should infants 6 months and older be vaccinated?
Not yet. That's not what the information has for us yet. In fact, the study that I heard about is looking at 12 to 17-year-olds, and then they'll probably extrapolate the 12 to 17-year-old data to younger children to some extent, but they'll also probably study it in younger children as well.
Any other questions? Did I miss anything? you do have questions, keep putting them in the chat. Like I said, we're recording this, so we'll share the recordings, and any questions that we didn't get to, we'll send out follow-up resources. So then I think what we'll do, well, first of all, thank you so much, Patrick. Thank you so much, Dr. Dworkin, for the Q&A. Patrick, I'm going to turn it over to you to talk a bit and expand on, what does this vaccine rollout mean for the contact tracing corps? So.
Thank you, Melissa. So the implications are massive for the vaccination and the vaccination rollout effort on a couple of different levels that I want to talk about. And, first and foremost, we are all folks who are in one way or another impacted by COVID, either directly or indirectly via our employment, our folks we know. And so I feel it's just tremendously important for us to have as much of this information as possible, just as people, as human beings who are existing within this space. On a professional level, as a contact tracing core and resource coordination hub, like, you're already receiving questions from folks, right? We know that. And we know that, you have questions, I got questions, right? And so we want us all to be as well informed in the work that we're doing as we can be. And so this presents like a shift in the work that we're doing, because it is another thing that folks are going to be asking us questions about, right? So just like when testing efforts were ramping up at various points, contact tracing and case investigations and resource coordinators got more questions about the tests, and about where the tests are, and about how to get the tests, and about whether they cost money, and about the difference between the different tests. I fade in and out. Thank you, Rose. And so, like, for all of these reasons, like, we want to try to apply the same level of information distribution as we can to you as the contact tracing core, as like one of the frontline professionals who are interacting with folks and providing information. When we first got started with this, trying to build up the community contact tracing core and the resource coordination hub, we knew that we needed this massive workforce to help respond to the pandemic. And we knew that contact tracing and resource coordination would be tremendously useful and important. We wanted to get it out to as many, to get access to these things to as many different people as possible. And so one part is I do want folks to hear and believe and feel that the advent and the implementation of this vaccination distribution efforts, it does not reduce the importance and significance of contact tracing and resource coordination. Those are still fundamental, necessary activities that we as a city need to have being done well, being done quickly, being done accurately. There isn't going to be a time in the foreseeable future where like contact tracing is just like, we don't need to do that anymore. Not going to happen. It is necessary. We need it. We need you doing that work. What has happened though with the vaccination rollout and the speed with which the vaccine has been proven effective and safe, the speed with which we are moving to stand up these points of distribution, it means that there's other stuff that needs to get done as well. And so having you all having this 600 plus person workforce of folks who can do this, who can interact with folks in a very real, honest way, is an opportunity that we want to take advantage of. Honestly, like it's a good way for us to do the work as a city. It's a good opportunity for you all as contact tracers and as individuals and professionals. And let's just be real about it. Y'all are doing contact tracing. We know that we're not getting all the contacts that we need in order for everybody to be working day in and day out, right? We're not getting the volume of contacts that we had anticipated, and that sometimes happens. Things ebb and flow, volumes go up and go down, and so for all of these reasons, we wanted to present the vaccination points of distribution as well as some other efforts as opportunities for more work that can be done right now, more impact that can be had, more positive impact and interactions that can be had with the community, with each other, as well as a professional development opportunity in public health. You know, contact tracing and vaccination are two fundamental core elements of modern public health. And so we see these as opportunities for, you know, you've been doing contact tracing, you know contact tracing, you're good at contact tracing. Here's another thing that is a pinnacle, or that is a foundational element of what it means to do public health. Just like, you know, personal commentary as well. One of the other things that's sort of a foundational element of public health, at least from working at the city as I have for the last 6 years, is shifting on the fly when stuff happens. You know, sometimes we have to, like, I'm specialized in this particular area, and something else has come up, and I'm going to be like detailed over to work on that. It is a good thing. It helps change our perspective. It helps broaden our areas of expertise, and it makes us better at what we do across the board. So we see that, like, the vaccination as an opportunity to do some really good public health work for the city, but also as an opportunity for the contact tracing core and the resource coordination hub through a couple of different specific things. One is, as was mentioned earlier, we did survey, the partnership sent out a survey to the contact tracing core for individuals who are interested in doing some work at a call center operation. So reaching out to organizations like dentists, dental offices, some manufacturing facilities, home healthcare organizations, to call those folks and, like, basically walk them through registering their staff to get vaccinated. That's a tremendously important thing, and in the short amount of time that effort is being done, it's like, I think it was like 2,500 people in the last week were contacted by way of that and put on the registration to get vaccinated. So that's a lot of folks. That's a tremendous impact. Other efforts we've talked about in the Chicago Cook Workforce Partnership surveyed about the interest in working with the points of distribution themselves. So as I mentioned earlier, we're standing those up very quickly. I got a request earlier today for 100 people to participate in staffing those facilities next week. So it's massive and it's quick. And the work that would be involved in doing those efforts, it's somewhat, just to be perfectly frank about it, there are set positions and roles that we've been asked to fill, like line monitoring, making sure that folks are wearing masks, making sure that folks are staying 6 feet away from one another, doing some registration work, cleaning up the facility after individuals come in and get vaccinated, making sure everything's sterile, and some other efforts. But I also just anticipate that it's going to be that you come in, this is the thing that we want to do, and there may very well need to be some adjustments made on the fly. So it is like, you come in and all of our job is to make these things work. That's sort of one of the perspectives that we try to apply to a lot of the things that we do. Like, this is my role, but my job is to make it all work. So what needs to get done, that's what I'm going to try and do. Further, there are some other efforts, like some of the community-based organizations involved in the contact tracing core are already involved in some of the hyper-local efforts that are going on. So the ones I'm most familiar with are like, there's some things going on in Belmont Cragen that are just specifically by, other than for Belmont Cragen in response to COVID. There's the Southwest Organizing Project is leading the efforts in 60629 and 32, specific efforts that are hyper-local to address concerns and issues that they're having. And so again, like by Evan 4 efforts, and then the 22nd Ward is also doing some stuff. So the opportunity for the community contact tracing core to get involved in these efforts and to be ambassadors of information, going in both directions, again, around vaccination, around contact tracing, around health, around all these things, it's all present and available. And so we're really wanting to work with you all to figure out how we can support you in doing all of this work. There is still, and there will be, as I mentioned, there's always the need for contact tracing. So I do not see a point in time where we're going to be disbanding the contact tracing effort. Just the reality of the situation, though, is that we don't have enough contacts coming through to warrant the massive the 600 people we've got. And we have a whole bunch of work that needs to get done around communication of information, both directions, again, going to the health department as well as from the health department, doing the vaccination pod work, reaching out to folks. There's a lot of work that needs to get done, and you all have shown yourself to be perfectly capable of doing this work. So we want to like capitalize on that expertise that you've got and make it a thing. So we're also so we've got these like formal efforts that come through. We've got like the call center operations reaching out to dentists and like manufacturers and such. We've got the vaccination pods. We've got these hyper-local efforts that are going on. We've got some other things like there's like the peer-to-peer texting that some folks, like 190 some odd of you have volunteered to participate in. Not volunteered in meaning that you won't get paid because it's part of your job, but anyway. We also were very supportive of like, what else? As Chicagoans, some of you, not everybody is, but as folks who are involved in this work, who are operating in community-based organizations and are interacting with folks, like I love the idea of you telling us what you've done, and you saying like, you know, over here at you know, back of the yards, we're going to do this, and we as the partnership and CDPH and UIC and SUHI and Malcolm X, like we want to support those kinds of, this is what our community-based organization thinks makes the most sense based on what we're hearing from our constituents, and with our resources, this is what we want to do to support our people in whether that's around contact tracing or vaccinations. We're supportive of it. So all of this is to say, like, the biggest implication takeaway is that there is a ton of work to be done. And the efforts, whether it's contact tracing, some of the time in vaccination work, some of the time, whether it's information sharing, whether it's, you know, putting information into my ear so that we at the health department can do a better job of sharing the information that folks need, or whether it's taking the information from the health department and giving it out to community members, to your neighbors, your loved ones. Like, it's all good. We just need to know that it's happening so that we can track it, monitor it, and make sure it's accurate. But we want that to be a bi-directional communication, and we want those efforts to be going on. And I do want to say, like, just sort of closing out this part of it, and I did see a bunch of questions in the chat that we'll try to address. This is all public health. So when we first came up with this idea of the contact tracing core and the resource coordination hub, we had, of course, the immediate need of, we wanted to have like this massive, highly trained workforce to respond to COVID, to do contact tracing, to do resource coordination. That's there, again, gonna keep being there. But we also wanted to use this opportunity for jobs, for career pathway, for economic development. So we wanted like these jobs to be in places that have been severely impacted by COVID, that have been under-resourced for generations upon generations, so we can try to build up, like, just like give folks jobs. Like, it's hard to have a job right now. So like, here's some more here's some more employment opportunities, let's go. Personally, I made a push, unsuccessful push early on, that I wanted to just pay people for sitting on the couch and watching TV because that's safer than going out to a job, but I lost that argument. But one of the other things we wanted out of this, right, like the longer term goal is to have, you know, we talk about the community contact tracing core, but what are one of our longer term goals is like community public health cores. Like folks who are my neighbors, who are me, who live in our communities, who go to my grocery store, who go to my school, who know about stuff related to health and public health activities, public health concerns, who are respected and appreciated and trusted people, like community members. We want this to convert eventually to a not contact tracing, not COVID specific resource for the health and well-being of Chicagoans in different parts of the city. So like, it really is like, what do we need to do in order to allow these things to happen? And so we are within the partnership and UIC and SUHI and NORC and Malcolm X and CDPH, we're committed to figuring out what are the best ways of providing all of these opportunities so that when this is all done, and it's not done yet, just because the vaccine's coming out and we're doing all these vaccinations, we're not done. We have a lot of work to do. I'm still super concerned about a whole bunch of things related to COVID, whether it's folks not getting vaccinated and that creating like hotspots of concern in particular populations or community areas. I'm still super concerned about some of the things that are, I guess, like social and public health byproducts of isolation, like suicidality, intimate partner violence, substance use. I'm still concerned about all these things that, like, the vaccine doesn't get rid of those, right? So we got lots of public health concerns. And what do we need to do when we are able to pull back a bit from COVID specifically, to find ourselves in a place where we have a 600+ person public health core that are experts in public health, as well as in community perspectives, and are the drivers of health and well-being in those areas. That's my spiel.
Patrick, so we had a couple of questions. So I'm thinking maybe we'll take a couple of questions and then we'll do a short break. So one of the questions that came up, let's see, it was about the case investigators and them being kind of overwhelmed, and if there's opportunities for contact tracers to do some case investigation work.
Yeah, so unfortunately, so yes, the case investigators are largely swamped. They're working like crazy. And they're trying. The end answer, the simple answer is at this point, no, there is not an opportunity for contact tracers to get involved in case investigation. And the reason for that is that case investigation involves a level of access to health-related data that is, at this point, within the authority of the health department. And so in order to grant access to that level of information to the contact tracing core, it would be a big old legal fight to figure out how do we grant what's called limited public health authority. There would be a massive increase of training and scrutiny being applied to what is done with this information. It's just not a feasible thing at this point in time.
And if someone does opt to work at one of the vaccination pods, will they be offered the vaccine?
Yeah. Yeah, so if you're working at a pod, you have the opportunity to get vaccinated. It is not required.
And then I think one more, if the contact tracer opts to work in one of the pods but decides it's not a good fit, can they just resume their role as a contact tracer?
Yes. I mean, ideally, we would have folks love working at the pods, but I appreciate the honesty of that question, because I was asked if I wanted to work at a pod, and I was like, I don't know, man. But I think, yeah, if you give it a shot and you're not digging it for your reasons, then yeah, it's perfectly fine to say. I mean, we would want there to be communicated, right? That I'm not going to do this anymore. I'm going to go back to doing contact tracing. Totally legit. What worries me most is folks just like not showing up. So long as folks are like communicating out that I'm not going to do this anymore, perfectly fine. Perfectly fine.
Thank you, Patrick. So I think a couple of folks have requested, and I'm sorry I didn't build it in, for us to have a break. I think we should take about 5 minutes.